Hey guys, welcome to Endocrine Pharmacology. In this video we will see antithyroid drugs which includes Propylthiouracil, Carbimazole and Methimazole. So let's start. These drugs has pretty good gastrointestinal absorption, so they are given orally. After absorption, Carbimazole is converted into Methimazole, so we will consider them together. Now let's go to their main site of action, that is thyroid gland. As we have seen in video of thyroid hormone synthesis, the thyroid peroxidase plays critical role in thyroid hormone synthesis. These drugs inhibit this enzyme and thereby prevents synthesis of new hormones. However, thyroid gland has stored already synthesized hormones which are secreted for about 3 weeks. So these drugs takes about 3 weeks for its effects to develop. Now, these drugs accumulates inside thyroid gland, because of which their effects last longer than what you would predict from their plasma half-life. For example, Propylthiouracil has plasma half-life of 1 to 2 hours. However, effect of its single dose lasts for about 8 hours, so it is given 2 to 3 times a day. And Carbimazole has plasma half-life of 8 hours, but effect of its single dose lasts for an entire day, so it is given once daily. Now apart from this, Propylthiouracil has an additional mechanism as well. As we have seen in video of peripheral conversion of thyroid hormones, most of the T3 is synthesized peripherally by deiodinase enzyme. Propylthiouracil inhibits D1 among these enzymes and thereby prevents peripheral synthesis of T3. In contrast to the previous section, this section starts depleting T3 level immediately. Now let's talk about uses of this drug. Being antithyroid, these drugs are used for a hyperthyroidism like Graves' disease, toxic nodular goiter, subacute thyroiditis, etc. There are 3 ways of using these drugs. One is in young patients with moderate disease, where these drugs are used alone as definitive therapy. Such treatment usually lasts long and relapse rates are also high. Patients with severe disease usually require radioactive iodine or thyroidectomy. Here these drugs are used along with radioactive iodine while awaiting its response and before surgery to achieve euthyroid state. For these indications, Carbimazole or Methimazole is usually preferred because they require less frequent dosing and have less side effects. Propylthiouracil, on the other hand, is reserved for some special situations. One of them is thyroid storm, where its property of inhibition of peripheral conversion of T4 into T3 comes handy. And second is in pregnancy. Propylthiouracil is more protein bound, because of which its placental penetration is less as compared to other drugs. Carbimazole and Methimazole, on the other hand, enters into the placenta and produces fetal toxicities. Did you notice how many times we have letter P here? P in Propylthiouracil, P in peripheral conversion, P in pregnancy and P in protein bound. This will help you remember these 2 special indications of Propylthiouracil. Now let's talk about adverse effects. An obvious adverse effect that you can predict from its mechanism of action is hypothyroidism. Reduced thyroid levels stimulates pituitary gland, so it secretes thyroid stimulating hormone, which in turn causes growth of thyroid gland and may cause goiter. Apart from this, rash and joint pain are among very common side effects of these drugs. A rare but very serious side effect is Agranulocytosis. So be cautious if a patient under this drug develop any signs of infection. Talking about drug-specific side effect, Propylthiouracil causes liver damage, so it should be avoided in children and even young adults. Carbimazole and Methimazole causes fetal toxicities like fetal goiter, choanal atresia, scalp defects, and aplasia cutis. Now let's have quick revision. These drugs are given orally. They inhibit thyroid peroxidase. They are used in hyperthyroidism like Graves' disease, toxic nodular goiter, subacute thyroiditis, etc. There are 3 ways of using these drugs. Alone as definitive therapy, along with radioactive iodine while awaiting its response, and before surgery to achieve euthyroid state. For these usually Carbimazole or Methimazole is preferred. Propylthiouracil is used in thyroid storm as it inhibits peripheral conversion of T4 into T3, and also in pregnancy as it is more protein bound and its penetration into placenta is minimal. In side effects, they causes hypothyroidism, goiter, rash and joint pain, a serious side effect agranulocytosis, liver damage by propylthiouracil, and fetal toxicities by carbimazole and methimazole. That's it for this video. If you found this video helpful, please share it with your friends. And don't forget to subscribe because lots more to come. See you in next video. Thank you.